Imagine a reliable method of birth control where your period is never late, you don't have any mood swings or weight gain. It gives you the freedom to fall pregnant easily when you are ready to, and without any harm to your reproductive system. It sounds too good to be true. Well, ladies, sit closer, because according to my next guest, all of this is possible. Her name is Claudia Slattery, and she's the only Justisse holistic reproductive health practitioner in Africa. Welcome, Claudia. Wow, Justisse holistic reproductive health practitioner. What does that entail?
It's a lovely name for something that really means natural fertility specialist.
Okay.
I teach women that our menstrual cycle is awesome.
I love taught that it's not, right?
Exactly.
In some shape or form, yeah.
I love my menstrual cycle. It tells me everything about my health. The key to a woman's menstrual cycle is ovulation. A woman can only ovulate once in every cycle. Now, ovulation, what do I mean by that? I mean when the egg moves out of the ovary and into the fallopian tube. Now, did you know sperm can survive in your body for 5 days?
5 days? I thought it was 2 days. Wow.
5 days? So you could have sex today, but only fall pregnant on Saturday.
Oh, wow.
Okay. Now, personally, I have a client whose sperm survives in her body for 8 days. How do I know that? Through the method of charting. So ovulation is the key. A woman is only fertile for roughly a week in every cycle. Okay. That means on average, if a woman is having a 4-week cycle, she has 3 weeks in every cycle where she can have sex without a condom and not fall pregnant.
Wow. That's quite a long period of time within the month.
Exactly. So why are women on
so
hormonal
obsessed about the contraceptive pill?
That's it.
Talk to us. Can I step back and just tell us why you decided to study this method and your personal journey?
My personal journey, I was on hormonal contraception like every other woman. I was on it for 5 years, and I was running with a lady by the name of Heidi. Heidi has been my mentor, and she just said to me one day, did you know the effects of hormonal contraception? Yeah. And I didn't know. And she personally had breast cancer, and I kind of thought, oh my gosh, what am I doing?
Yeah.
Am I increasing my risk of breast cancer? Anyway, I walked away from that conversation, never thought too much of it afterwards, but it kept on playing with me. And my husband was going away for 6 weeks at the time, and he said, go off the pill. And before he came back, I could not actually get myself to go back on it. At that time, I thought I'd rather fall pregnant than go back on it.
Yeah.
So I started to research, and I found this method, and I thought, this is what I'm going to do.
Yeah.
So I taught myself how to chart my menstrual cycle. However, Google is not that effective.
Yeah, yeah.
And it's not easy to do by yourself. And that's why there is such negative perspective on it.
Because it seems like it's a lot of work, but again, stepping back, just so women understand some of the negative effects, if they didn't know it was from their contraceptive pill: headaches, weight gain, mood swings, decreased libido. That was a big one for me, and the reason why I actually came off the pill. And I mean, a whole bunch of other issues as well.
Depression is a huge thing as well, hair loss. And when you actually know what your cycle is doing, you know when you can have sex, when you can't. A woman is only fertile for roughly a week in every cycle, and you're fertile or you're not. There's no in between. So you will know every single day, yes, I can fall pregnant, or no, I can't.
Yeah. What does it mean to, then chart your cycle? Because I use an app.
So many women do.
It's so much easier because, like you said, Google is not necessarily your friend in this regard. It does take quite a bit of work.
Okay. Your app, does it know when your parents, your father-in-law and your mother-in-law are staying with you? Does it know when you have a huge deadline and you're stressed?
Yeah.
And that's the downfall of these apps.
Of the technology,
Okay. No app is so incredible. It can say, hey, have a baby, hey, you can fall pregnant, or no, you can't. Your body tells you. So this method can work for a woman who has an irregular cycle, or when your cycle goes cuckoo on you, because your cycle will go cuckoo on you at least once a year.
Yeah.
A woman produces cervical mucus, and mucus is the key to falling pregnant. So if you've got mucus, you can fall pregnant, and you have 75% chance of falling pregnant if you have sex on that day. Now that's an A at varsity.
Yeah.
So if you have no mucus, sperm cannot survive in your body without mucus. And that's how you know you can't fall pregnant.
Is there a period of time that it takes to sort of regulate the system and, you know, get off the side effects of the pill?
A woman, it comes off a hormonal contraception, and it can take a couple of months to as much as a year.
Oh, wow. Okay.
So some women who come to me, yes, it takes about a year to really get a cycle looking beautifully. Others will go back into the old previous cycle before using hormonal contraception, just like that.
You talk about using a special type of thermometer in this charting process.
Yes.
Tell us more about that.
A basal body thermometer, it reads to 1/100th of a degree.
Oh, wow. Okay.
Not your normal bought thermometers. This thermometer will actually help identify where is ovulation. So your change in temperature in the middle of the cycle,
that's indicative.
will suddenly
okay.
jump up by a degree, and you'll actually see it going up. You'll go, whoa, hello, why is my temperature so high? And it's so incredible because as soon as ovulation has occurred, the temperature will rise. It will stay high for the rest of your cycle. The day your period comes, your temperature will drop. So you always know when your period is coming.
Wow.
And from ovulation until your next period, it's always the same amount of days. So a woman who charts her cycle always knows when her period's coming because ovulation is the key. After ovulation, she knows how many days is her next period, and then when the temperature goes down on the thermometer, her period will come in 24 hours. So your body's telling you every single day where it is in the cycle. You just need to know how to read all the signs.
Are you encouraging women to come off the contraceptive pill only? Are there other methods that are used, for example, the loop or the Mirena, whatever they're called, that you're also encouraging women to come off?
The Mirena is a hormonal contraception. It has very negative effects on many, many women. I know women who've walked into my practice nearly losing their eyesight due to it.
Wow.
Okay. The other option of a natural birth control method would be the copper T. That is your only other natural option apart from condoms.
Okay.
However, with the copper T, it is a copper. It is a medical device. So some women have a very bad effect with it.
Yeah.
Other women love it.
Yeah.
Okay. Mirena, I personally will stay away from because it is a device inside your body that you have no control over. So the pill you could stop taking if you had a side effect. The Mirena, you actually have to go to your gynae, get it taken out if it doesn't work for you.
Yeah. Are you finding that you're getting support from doctors in the allopathic world, from conventional gynecologists, or not really? Is it, sort of, is it a controversial space that you operate in?
Yes, because a lot of gynaes want to put every woman on hormonal contraception because it's easy.
Yeah.
However, it's very easy if you don't want to fall pregnant. But what happens in 5 years when you want to fall pregnant? And no gynae should be putting the Mirena into a woman that wants to fall pregnant. That is something that I'm seeing every day. Women walking into my practice, they've had the Mirena, but they want to fall pregnant.
Yeah, and with infertility rates increasing, and then women having to, or families having to resort to, or couples having to resort to IVF as a treatment, you would think it's the two are counterproductive actually at the end of the day.
That's it. Women are being put on hormonal contraception from a young age, where go right through their reproductive years, then they go for IVF, and then we wonder why we have cancer.
Give me some good testimonials. What did women start experiencing once they started natural birth control methods, charting their cycles, and have come off the contraceptive pill?
Women walk into my practice by the second or third session and go, why was I not told this at 12 years old?
Yeah.
That is why I've started a program that I will start going into schools and educating girls about our menstruation, teaching them to love our cycles, because our cycle tells us everything.
Yeah.
Women just say, I feel empowered, I feel educated, and guess what? I have a sex drive. My husband and I have a relationship because we've learned to communicate. When I say to him, my love, I'm fertile and we can't have sex, we do other things, it actually brings communication in a relationship.
Yeah.
So this method goes far beyond just a birth control method. It goes into a space where a woman understands her body and she has a relationship with her body.
Fantastic. Thank you so much for coming to share this with us. It's a question that's come up time and time again. And as we mentioned, in this respect, Google is not really your friend. You have to book a session with someone that knows what they're doing, unless you're really willing to put in the time and the hours to read through the plethora of information that is out there. But Claudia, thank you so much for coming in.
Pleasure.
I'm sure many women will be giving you a tinkle just to come and see, how they can chart their cycles. When we come back, we look at natural foods to alleviate the symptoms of adrenal fatigue. And later, also on the topic of women's health, we look at some of the psychological causes that prevent us from wanting intercourse for long periods of time.